Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Hello, welcome to the latest episode of the POMA Does podcast series, sponsored by the Pennsylvania Osteopathic Medical Association. My name is Dr. Justin Berthold. I'm a physical medicine and rehabilitation physician. I'm with a group called Rehabilitation Physicians of Pittsburgh. And today we're going to be talking about how to maintain your osteopathic skills. So I'm very privileged today to be joined by two wonderful guests who I happen to know very well. One is my partner, Dr. Timothy Berg, and also joining us today is Mr. Brody Walker. He is a fourth-year LECOM osteopathic medical student applying for physical medicine and rehabilitation residency programs and has been on rotation with us for about 4 weeks now and has really enjoyed his experience and learned quite a bit about osteopathic applications in physical medicine rehabilitation. So, gentlemen, thank you very much for joining me for this podcast. I know we all put in a long day today, seeing a lot of patients, and I appreciate that you're willing to stay later after clinic and talk to our guests here tonight about osteopathic skills. Why don't we just start off with a little introduction? If you want to give us a little background about yourself, we'll start with Dr. Berg. Why don't you tell us a little bit about yourself?
Alrighty. Hello, I'm Tim Berg. I'm a Pittsburgh native. I am a physical medicine rehab physician as well, trained at UC, and I've been with Dr. Berthold and the Rehab Physicians of Pittsburgh now for 10 years. We've had our 10-year anniversary this year, so it's been amazing, a wild ride, and it gets better every day. So I just want to say thanks to Justin for creating the practice and inviting me in and letting me help you build it. So thanks, and thanks for having me here tonight. So super excited.
Hey guys, thank you again for that introduction, Dr. Berthold. As you said, my name is Brody. I'm a fourth-year medical student at Lake Erie College of Osteopathic Medicine. I'm up at the Erie campus, and the time of us recording this is October, so I'm right in the middle of my residency applications. I am interested in hopefully pursuing a career in physiatry and continuing in the footsteps of both of you guys. A Pittsburgh native as well. But coincidentally, I guess, up in Erie, Dr. Berg and I had a similar mentor. I hope he's watching this out there somewhere, Dr. Doug Greiser. I was fortunate enough to have his connection to set us up and, get to learn from one of the best. So I'm very thankful for that and thankful for the knowledge you guys have shared over these past 4 weeks. It's been great, and I'm very happy to be here. Hopefully help out who's following my footsteps next year, hopefully.
Thanks, Brody, for that introduction. Yeah, and it's been a great 4 weeks working with you. And I think you've had a good opportunity to see how osteopathic medicine really helps as an adjunct tool for assessing and treating a lot of our patients in physical medicine and rehab. So we'll kind of start with that topic. And Dr. Berg, why don't you kick things off here? Tell us a little bit about how osteopathic medicine has helped you become a better physiatrist or physical medicine and rehab physician.
Okay, yeah, sure. I mean, I've been involved with osteopathic manipulation since even before med school. I was interested in it, and it really drew me to osteopathic medical school. I thought it could be a fantastic way to help my patients in the future, and it's definitely proven to be that. I use it, I'd say, most days of the week. Patients coming in regularly again and again for different issues, and then we get them better, and they come off for another one, and a lot of referrals from mostly probably word of mouth, hearing that they can get treatment with osteopathic manipulation and get benefit in the office. So as far as how it fits with our practice, I think it's a perfect fit for any physiatrist, for a rehab doc. With the knowledge base we gain in osteopathic medical school, it set us up well for physiatry and going forward and learning in residency. MD colleagues in residency, we had a greater knowledge of the musculoskeletal and the neuromusculoskeletal system, kind of teed up to succeed in residency already. So that was huge. And then just going into practice with it, we're often able to treat patients, even patients that have been, trying to get treatment for years and years and can't get better, come to us, and sometimes we figure out a nice, easy way to get them better with just some hands-on treatments and very gentle and non-invasive, preventing them from getting surgeries and changing people's lives. I mean, one guy I could think of, anecdotally, was a patient came to me, had like 5 years of headaches, severe frontal, seemed like tension headaches, but he had been working on a garage and kind of dropped the roof on his head, actually. And I was quickly able to figure out that it was a cervicogenic headache that he was dealing with. And we went straight into osteopathic manipulation, worked on his neck just once a week for a good 5 weeks. And every time he came in, he got better. I remember the first time he followed up after that, he said it was the first time in 5 years where his headache went away. And then it came back before he saw me again and then got it to go away again. And then by the 5th visit, it was gone and got him better and got rid of 5 years of headaches pretty easily. So it's been very helpful in my practice.
Yeah, it's a powerful tool. I think a lot of DOs finish their training and they go into residency and start their career and unfortunately don't use it. You know, we were looking at a study recently showing that only 7% of DOs actually implement osteopathic manipulation into their practice. And that's a huge disservice for a lot of people because it does help and you can see real-time improvement. Patients can come in and leave the same day with noticeable improvement. And there's that whole therapeutic aspect of hands-on care, and it helps you kind of connect more with your patient, get to understand them a little bit better. So yeah, I encourage all medical students to stay fresh on your skills and to continue to practice in residency and beyond because it's really a useful tool regardless of what field you're in. But yeah, I mean, I felt the same way as you did with PM&R and going into residency, particularly that first year of training. I felt like I had an advantage over our peers because of what we learned in osteopathic school. I mean, just the ability to palpate different bony landmarks and to perform different musculoskeletal special tests. I felt like that was a huge advantage compared to some of our colleagues in our same class. And it was kind of cool, you know, I think as a resident, I feel like our co-residents and even some of the attendings really looked to you, you know, if they needed help with like a musculoskeletal osteopathic, you know, I remember doing like the Epley maneuver. Nobody knew how to do the Epley maneuver. And they're like, you know, get Justin in here, see if he can do it. And, you know, it was like very rewarding to have that experience. And there were a lot of different times where we could implement those skills during a busy clinic. So Brody, yeah, kind of kicking over to you. I guess you've had the time spent with us over the past 4 weeks. Can you shed some light like on how you've seen osteopathic manipulation be incorporated into the practice?
Yeah, you know, I'm in a unique situation, unlike you guys, where you guys have years and years of experience and practice to see this stuff work hands-on. In my shoes where I'm at right now, still being in medical school, studying for boards, worrying about all these interviews, there's just a plethora of information that's thrown at us medical students' heads every single day. And it's very hard for us to try and categorize all of that and make sense of it. But I think the knowledge that we've received in medical school, specifically geared towards osteopathic manipulation, helps us form some of those connections, not just with the anatomy, but how the anatomy corresponds with the physiology. And as a student currently learning how real medicine works in the real world, those connections are huge. And I really do, like you guys said, think it gives me kind of an advantage over some of our MD colleagues.
What about the use of OMT in physical medicine and rehabilitation that you've seen compared to some of the other rotations that you've done? Are you seeing OMT used in other clinic settings and different practices?
Unfortunately, not as much as what I would have liked, which is why I'm so geared and focused on physical medicine and rehab, because I just think it's such an excellent tool to be able to use with our hands in the office. And what you said, have your patients walk out of the room in a much better condition than just what they did coming in. There's very little interactions in terms of worrying about different drug interactions with each other, looking at, you know, social and economical issues. I just think it's a great option that almost anyone and everyone could benefit from.
Yeah, I agree. And I think it actually adds like another layer to the visit. It kind of slows it down a little bit, allows you to talk to the patient more and kind of get to know more about them as a human being. So that's another thing I really like about it.
So I think they appreciate it a lot too, just because I think it adds to the physician-patient relationship. Unfortunately, in certain fields, it's a very high-paced, in and out kind of relationship that the physician and patient gets, but taking the time to do that OMT, it really means a lot to those patients. And I think their feedback in that light has been very positive. And that's something I've noticed just as a student so far.
I mean, you're an excellent student. You've done very well so far. And I'm sure, you know, you had a lot of different options on where you could go for medical school, but you probably chose to become a DO student. So tell me about that. Like, how did you develop an interest in osteopathic medicine and using OMM?
This pathway kind of started for me back in high school. Before I even thought about looking to be a DO, I was a pre-physical therapy major coming into college. And I just loved the musculoskeletal system. I love the anatomy. Coming from an athletic background and working on rehabilitating some of my own injuries, I really just enjoyed the process of rehab and, understanding the muscles, their actions, what they do, how to involve that. And as I furthered my interest in medicine, I thought that osteopathic medical school was a great way to continue with that knowledge base of my anatomy, but also incorporating some of my other interests in medicine in general. And I think it's just a great way for me to expand my reach and helping people, which is why I really wanted to come into this field. And that was one of my main attractants to osteopathic medical school in general, as opposed to some of the allopathic options that I had the choice of going into.
Yeah. I like the whole body approach and the mind, body, spirit philosophy. I think that's something that we should strive to promote every day and when we're treating patients. I remember my first exposure to OMT. It was demonstration of a muscle energy treatment for an innominate rotation. I mean, you watch it happen right in front of you, and I don't know, at first it's you don't believe what you're seeing because it's you can sometimes have very significant change afterwards. But I remember that technique and I just was very interested. I was just captivated from there and just wanted to learn more about it. So yeah, I'm sure we've all kind of had that same type of experience the first time we saw osteopathic manipulation being performed. Now we're the ones performing it and hopefully inspiring the next generation to get involved in this career because it's been a great career. So Dr. Berg, you have any other stories about your first experiences with OMT? I know we were talking a little bit the other day about the treatment of a colicky baby with OMT and how it had a significant impact. That was a pretty cool story. But any other eye-opening experience you had at OMT where you thought, this is what I need to do?
I mean, definitely after getting into the education of it and learning more about it and using it. And as a med student, I remember bringing it home on breaks and using it on my family members or on Christmas break or something, and seeing those anatomic landmarks going from, abnormal and putting back in normal, and mom or my dad's pain going away in their low back. It felt right to me. I mean, the biggest reasons I went into medicine was to help my family and friends. This has allowed me to do that in a very safe and successful way. So that's been great. On the same line as earlier, as far as how it fits into my practice specifically in this field, I was thinking about, EMGs. I'm an electromyographer. I do a ton of EMGs every day, probably on average 4 a day. And the ability to have that knowledge going into a PM&R residency of the muscles, where they're at, exactly, what their actions are, all the stuff that they beat into our head in med school. You don't see it at the time of why that's important, but then when you get to the residency and you're trying to figure out what muscles to needle on an EMG, and it just comes to you naturally because you already have that knowledge base, it just makes you a much better physiatrist just having that knowledge already. So
I can kind of parallel that a little bit, with doing ultrasound guided injections. Ultrasound is a powerful tool because you can see the tissue in real time and just identify all the important landmarks. But I can't tell you how many times I start off my ultrasound examination by palpating the structure just to make sure I know where I'm at. It just kind of gives me a home base awareness of the anatomy of that person. So I kind of teach that too when I work with medical students that are doing procedures. Just because you have the expensive machine that allows you to see structures below the surface of the skin, don't forget about your hands that you've trained for however many years to be able to palpate very important structures. But yeah, you brought up a good point about, how you kind of practice your skills working on your family members and friends. And OMM or OMT, whatever we prefer to call it. I say OMT. What do you guys say?
I'm an OMT.
You're an OMT guy? Yeah, I mean, for OMT, it is a skill set. So with any skill, if you're not practicing it, you have the propensity to kind of lose that skill set. It was interesting to hear you say that you kind of practice a lot on your family and friends. I did kind of the same thing, I would say. Tell us a little bit about how you practice, Brody. Do you have family or friends that you treat, or do you get together with some of your co-students and practice?
So rehab in general is just a big part of my life. My wife is a physical therapist, so she purchased a plinth or a manipulation table for us to have back when she was in physical therapy school. So we keep that at our house all the time. And just like you guys were saying, anytime our friends or family come up and they're having issues, whether it be headaches or low back pain, some of the calming issues, I always offer to, throw them up on the table and see what I can do. Just in terms of saving them a trip to the pharmacy or saving them a trip to the doctor's office, it's amazing what you can accomplish in just a short amount of time just by having that knowledge in your back pocket and being able to manipulate them and treat them right there on the spot. Their feedback feedback is direct and it's almost always positive.
I encourage a lot of students purchase some type of table that they can use, a portable table, so they can practice their skills. And that's really important through residency as well. Good talk so far. So a couple other thoughts here. So like, what would you recommend to other fellow student DOs or fellow DOs to try to maintain or improve their skills? Is this the type of thing that you need to go to annual training or conference once a year to kind of stay fresh on your skills? Is it dependent on what field you're in? You guys have any tips or suggestions for some of the fellow DOs out there that might want to improve their skills or at least maintain them?
I've never been to a conference as a medical student quite yet. So Dr. Berg, if you want to elaborate on that, I'll go after you.
I've been to some of the osteopathic conferences in the past, and I feel like they're a great way to keep up your skills and definitely using it. I mean, you have to use it. You lay your hands on the patient, work on your diagnostic skills. You have to diagnose specific areas in their somatic dysfunction. And from those diagnoses, just like you learned in med school, you figure out the right treatment to use to correct them. And you always go back and check and make sure you have that corrected. You know, you see a rotation or a pelvic obliquity or something, you want to double check after you treat it, see if it's gone away, and reassess the patient, see how they're feeling afterwards. But yeah, you have to use it. You have to use it frequently. Is it just like anything? Yeah, if you don't use it, you will lose it. So really a way to keep your skills up other than using it. And never be scared to ask your colleagues, or never be scared to go back to the book and then check out, make sure you're doing it right. Go back and read, to pull out your notes from med school and look at them and use them. And we do it all the time here still. We're 10, 11 years out and from residency, and even more so from med school. And we're still talking to each other, asking each other if this is what you would have done, this is how you would have done it, going back to the books and looking at it and making sure we did it right, especially when it comes to some of those things you don't see all the time, some of those backward sacral torsions and things. You need to refresh yourself. So there's nothing wrong with going back and looking or asking questions.
The Chapman's points or, any of the other things that you forget, and then you have to keep kind of looking back to remember them. And we all have our own favorite techniques. I'll get to that question in a little bit, but go ahead, Brody. You wanted to add something to that?
I was just going to say, I think Dr. Berg somehow found a way to virtually steal my exact thoughts.
You guys have become one through this 4-week rotation.
Must be something. I could feel him in here.
Yeah, it's been exciting to watch that.
It's the vectors. He's here. I was just going to add to that, don't be afraid to be challenged. I think as a medical student, it's very easy to get caught up with the imposter syndrome, which we're all victim of in some form, where you're going about your business, your practice, and you think and in the back of your mind, you're like, is this right or not? Just to give an example, the other day, I was working with Dr. Berg after hours, kind of manipulating and adjusting him. And I was doing one thing and I was just a little bit iffy about it. And he was quick to tell me, shouldn't you be doing this? And I'm like, oh yeah. And it's a great thing, because I think a lot of us, we learn by our failures. It's one thing to just go through the motion and act the part, but being able to fail and learn from those mistakes and take that moving forward, I think in the long run is much better for our retention. And yeah, just don't be afraid to challenge yourselves and, ask questions from your peers and those above you who have been doing this for a long time, and don't be discouraged by their feedback and their input, because at the end of the day, it's only going to better yourself and better your care for your patients down the line.
Yeah, that's a good point. I think when you're a student, everything's like intimidating. You're just learning. You go from month to month trying to learn an entire new system, and you're just trying to wrap your mind around like the medical knowledge and the basic science. And it's a difficult time. So allowing yourself to learn and to ask questions and to not really be shy about it, I think that's an important part of developing as a student. So yeah, and you've done a nice job with that, Brody. So good job with that. Keep it up. All right. Favorite technique. Like I use muscle energy quite a bit. That's mostly what I use. I'm just most comfortable with that. I find it to be a very gentle but effective treatment. I'm a muscle energy guy. What do you guys use primarily?
I definitely like muscle energy is my probably go-to. I feel very comfortable with it. I felt comfortable with probably all of the techniques in my time, but some of them are, far behind me now, and I just don't use them because I find I can get most things better with the ones I still use frequently. But I'd say counter strain, I do pull out from time to time. Nowhere near as often as the muscle energy. And then just working on the myofascial planes, I use that probably just as much as the muscle energy. But I feel like muscle energy, I can get most things done efficiently and effectively.
FPR, I'd put a facilitate positional release on my list as well. I have to use that, especially for like the rib, like the upper rib. Yeah. How about you, Brody? Do you have a favorite?
I would agree with the muscle energy. I think, in medical school, I think we're all drawn to the HVLA just because of the satisfaction you get from the actual manipulation. And you hear people saying, oh, you got a pop. It's a good feeling, but I think for the long-term benefit, you get the most bang for your buck with the muscle energy, simply just because of the lasting effect that the muscle gets. It's one thing to do a manipulation with HVLA where you quickly can manipulate the skeletal structure, but if the muscles aren't still supported to follow that up and back that up, it's quickly going to fall right back into where you manipulated it. Whereas I think with the muscle energy, the muscle activation itself kind of can orient your structure in a way that's more sustainable over time. So I think I get a lot of success with that, especially in the setting that I've been in the past 4 weeks with you guys. A lot of back pain. You're always in the back of your mind worried about herniated discs, listhesis, things of that nature. And that's not anything I would ever want to risk doing an HVLA technique for. While most of them are safe, you always run that risk. And I don't feel nearly as uncomfortable with the muscle energy as I do with some of those HVLA techniques. So I would agree, muscle energy for me.
I mean, that being said, Brody, you did fix my thoracic issue with some HVLA.
There is a time and place for it when right.
It's one thing to be wrong on a test, Brody, but to use the wrong technique and, maybe hurt your attending physician, that's a little worse, I would say.
Risk I was willing to take.
I'm good.
All right, good. So last question, then we'll wrap it up. So a little bit about patient satisfaction. How have you seen osteopathic manipulation affect patient satisfaction? Do your patients come back and typically want to get more treatment? Is it something that you do the first time and they're better and then you never see them again? Like, how do you guys incorporate this, into the real life, and what type of real results are you seeing in terms of patient satisfaction?
Well, I guess I do it one of two ways. I'll often trial on a patient at the visit, tell them what I think's going on, why I think this will help them, and then get into it and then assess at the end, how you feeling? And, more often than not, they're feeling really good already, getting some relief, and then say they'd like to come back for more. So we get them on the schedule for multiple visits if possible. Sometimes it just depends on, people's hectic lives and where they're at. And sometimes I'll say, okay, just come back in again one time. We'll see how you do then. And if it's still there, we'll bring you back in if it's not going away completely. So I kind of feel that out depending on the patient. But again, most of the time, if I go down a pathway of treating them with the osteopathic manipulation, I can get them better for a lot of different musculoskeletal issues. Now, when I feel and diagnose them, and I think that is the right choice, right? So if it's certain things that I don't think are going to work with any osteopathic manipulation, well, we don't do that. But
yeah,
I mean, even today, I had Brody working on one of my patients, and is just a giant person, a very large human. He's got some pretty significant musculoskeletal issues going on. He left so happy after having Brody work on him. And I've treated the guy before as well with some osteopathic manipulation, but he seemed over the top today. And, he was able to put a little more time in than I probably would have been able to. If that was it, or if Brody's just better than me, I don't know.
It's debatable, I guess, huh?
That was a success.
Yeah. I mean, that's the thing. Like, you have people that will come in maybe with an acute issue that will get treated and get better and leave. And then, like, I feel like I have another subset of patients who sees me more as like a maintenance, patients that may come in once a month or every couple months just to try to get, their body in a better state of balance or homeostasis. And I'm sure you have patients like that as well, Dr. Bird, right? I mean,
and it's funny because they often come back in like, my hips rotated again. Can you do that thing you do? And then they're like, oh, that muscle energy you doing that. And so I'm just tell me what to do. All right, listen.
Yeah, they can feel that something's off, like something's not quite right. Yeah. Right.
I think going off of that too, really, the proof is in the pudding in terms of the patient adherence to the OMT. I have yet really to see or treat a patient who gave me feedback saying, oh, it didn't really work. And I just think they feel very safe with it. We as the providers, clinicians, student clinicians and physicians, we all feel really safe with it. Some patients, they hear the word injection or steroids and they kind of lean against that just for the possible risks and adverse reactions that could come with that. But OMT, they feel very safe with. And very rarely have I seen in the past 4 weeks a patient miss their OMT appointment. Patients cancel here and there and they forget about an appointment and they don't show, unfortunately. But those OMT clinics, they are there. They're early. They're looking forward to it and they leave always in a better condition than what they came with. So I think that says a lot about it as well.
Yeah. Excellent. Well, that's a good one to end on, Brody. I think you're going to get the last word today. So nice job. We appreciate the insight there. That'll end our podcast for today. I'd like to thank each of you for your time and joining us today. If you have any feedback or episode ideas, please email them to poma@poma.org and be sure to subscribe to the POMA Does podcast series on your favorite podcast platform or POMA's YouTube channel, which we all visited about an hour ago to see how this is done. So we appreciate you spending time with us today, and we'll see you again next time.
Thank you, everyone.
Thank you, guys.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.